Obrigado. Bom dia, everyone. I will speak in English, but hopefully you will understand me if I am understandable. I have 30 minutes, and I am very much following from the previous speaker in emphasizing that any health system, if it is to be effective, needs to value the people who work within it. And I will also be picking up on one of the other themes that we've already heard about in terms of the need for change in health systems and the need for, in some cases, radical change, but more often adaptive change over time. So, I have 30 minutes. And in terms of an outline structure for what I will present, I will begin by looking back. My initial intent when I went to university was to be a historian, and I took the wrong path somewhere, and I have ended up being a health policy analyst. But I always believe that if we are to look forward and progress effectively, we need to also look back and understand how we have got to where we are. I will then briefly present some data which will locate Portugal in the broader range of European countries according to some very important health workforce indicators. Pick up on issues related to shortages, which most health systems are having to deal with in terms of notably shortages of health professionals. And briefly look forward at the next generation of potential health professionals, and also I will touch on the use of technology. I'm aware that many other speakers will look at this in depth. So I come at technology with an agnostic view. I'm starting from the workforce and looking at how technology can enable the workforce to be more effective. And I'll conclude by setting out a potential framework for action that's been developed by WHO for health workforce, and my own closing thoughts on what does sustainability mean when we look at the health workforce within an effective and sustained health system. So, I've used this slide a couple of times before in conferences. It's a statement advising on the risks of over-specialization in the health workforce. And I have a little audience quiz at the beginning to ask people which country do you think that might be describing and what was the date. But because I've used it once before in public and I used to offer a small prize, there's no prize on offer today, but has anyone any thoughts on which country that might be describing and roughly when? It's reporting on the risks of over-specialization. The country is Egypt, and it's a quote from Herodotus about 2,000 years ago. So I've just put that there to highlight that some of the issues that we think might be new have been around a long time. And also, probably you do not think you were going to get some classical education today, but there you go. There's a little bit of classics to begin my presentation. So what I'm going to do now in my next few slides is quickly and briefly use data to present the pattern across European countries and locate Portugal within that in terms of health workforce dynamics. There are 4 or 5 slides. They're all taken from a very recent WHO report that can be downloaded from the European Office website. And I acknowledge WHO because some of the slides they have provided for my use. So just to look at some of the key metrics and how things have been changing. This is the change in density of doctors per population across European countries. And if you have got good eyesight, you will see that Portugal is 6th from the right. So it has, over the period reported, about 10-year period, has experienced one of the more rapid growths of doctors in relation to population. That doesn't mean that's enough. That doesn't mean they've got the right skills. That doesn't mean they are in the right place. But there is an underlying positive message there that you have seen growth in Portugal. I should also say that these data are before the pandemic, some of them, so we need to recognize the year zero effect of the pandemic in terms of how some data analysis can be prolonged. This is the same data for nurses. Again, a variable growth across the different countries of Europe. And Portugal, you're around about the middle there. So again, you have seen some potential growth. And then looking at the generation of new workers coming in to the health professions from, again, from different countries. This is looking at the medical graduation rate across European countries. And in terms of where you locate, you are, I think, 17th from the right in terms of the increase in production. So you're round about the average across European countries, but as you can see, there's a very big variation in the extent to which, across that time period, we have seen countries increasing or not increasing the number of doctors that they are educating. So that's just a very quick look at some of the backdrop, and from that you can be glass half full or glass half empty. You can say Portugal is not looking too bad in terms of growth for doctors, less so for nurses. But the more important question, obviously, and we've already heard that discussed in some detail in the previous presentation, is the extent to which is more enough? Do you have sufficient? Do they have the right skills? Are they located where they can be most effective? Are they enabled to be effective? Another dynamic which affects the health workforce in all countries is the international connections. And that is most obvious in terms of mobility of health professionals between countries. And this is a phenomenon which was growing, stopped more or less for the pandemic the first year, but since then we have seen a rapid increase in the number of doctors and nurses moving across international borders. To oversimplify, it is mainly doctors and nurses moving to countries where they can earn more, where they can have more career opportunities, and in some cases just have personal safety. And the dynamics and mobility that we are seeing is becoming more complicated. Some countries, like my own, the United Kingdom, has a long history of active international recruitment from other countries. Other countries less so, but beginning to become notable. Germany, Denmark would be two countries in Europe that are now beginning to actively recruit nurses from India, for example, to try and make good shortages which have become more pronounced because of the pandemic. Demand increasing, supply of health workers not keeping pace. So if you just look at this graph here, this is just showing where the majority or most health workers who move are their destination, and it's primarily the high-income OECD countries in Western Europe, Northern Europe, North America, Australia. English Anglophone countries are sucking in many health workers. And we, as I said, we're all connected, so any country that is looking to try and have a sense of whether it is training sufficient for its own needs in the future needs to take account of any inward or outward mobility as part of that process. And I don't know the current situation in Portugal, but I do know that 10, 15 years ago, the UK was very active in recruiting Portuguese nurses. They were regarded as very well trained. Many spoke good English. And at that time, we were part of the European Union, so it was an easy recruit. That's changed as far as the UK is concerned, but the issue here for you or for any country is you could be vulnerable to outflow by countries that can pay more coming and recruiting actively. So planning does not occur within the border only. You need to take account of, are you reliant on doctors and nurses coming in? Have you a concern doctors and nurses going out? So, a common theme in most countries currently is health workforce shortages. And when you unpack the reasons for that, and they are graphically illustrated here, this is an oversimplification, but in order to begin to understand how to address the challenge of shortage, we need to be clear about why it's happening. And there are both supply and demand concerns. The blue ones on the left there, concerns about, are we training enough health workers? Have we seen burnout or reduction in hours available after the pandemic from some health workers? And that's certainly the case in most of the countries I know about. So there are some long-term supply issues, and then there's been an acceleration of supply concerns because of the pandemic impact. And then we also have demand-side challenges. Aging and growing populations. Portugal and many other European countries, some aging in the population leads to more and different types of demand, which require different types of health service delivery, as we've already heard. The pandemic itself has impacted on health demand, accelerated it, increased it, and raised some chronic diseases to a level that didn't exist before. And the shortfall between supply and demand, as I say, that's oversimplifying it, but every country is looking at that graphic and understanding that it describes the situation. You then need to try and look at what the numbers are for your own country in terms of how that balances out, to be clear what the shortfall, the difference between supply and demand is. That's best achieved, obviously, through some degree of national workforce planning and projections. So you look into the future. So this is where I'm beginning to talk from looking back to looking forward. Where are we now? Where are the current challenges? How many new nurses and doctors are coming into the system? And make projections. Do we have enough? Do we have a shortfall? What do we do if we have a shortfall over the next 5, 10, 20 years? And one notable challenge, as I've said, across Europe is the aging of the population, and that's just a Europe-level, very nice, simple little diagram, but it's showing the direction we're moving in, which then needs to be taken account of at country level. More older people in the workforce, in the population, and what that means for demand for health services. And also, many countries have a health workforce that is aging, and that also brings with it challenges of retention. How can we encourage older health workers to continue to contribute? It also obviously has issues related to replacement. These health workers will retire, some of them quite soon. What do we do to replace those who are going? And if you look across Europe at this figure here, this is from WHO. They've described it as a ticking time bomb. The proportion of doctors in the older age category, with the European average, the red line. And Portugal, I think you're 19th from the left, so you're just below the European average, but you still have a challenge. Can you encourage workers to work for longer? And what do you do in terms of replacing those who are going to retire? Okay, Another issue, so we have the aging workforce, we have supply-demand gaps potentially growing more pronounced in some countries, and within countries often quite different in different regions and different specialties. Another issue is, can we encourage the next generation to come into the health professions? The point already made by previous speaker. What is happening to perceptions of school children about the health professions as somewhere to dedicate their life? OECD published a short paper just a couple of weeks ago, which used the PISA study, which is an annual survey of 15-year-old school children, and it asked them, which careers might you be thinking about? And this graphic shows the percentage who reported that they might think about nursing as a career. And it's at the 2 points in time of the two last surveys. 2018, which is the diamond, you can see, and 2022, which is the blue column. The red is the OECD average. Portugal, you are below OECD average just in terms of level of reported interest in nursing as a career. That's the bad news. The good news is that compared to 2018, you have seen a marked increase in the proportion of school leavers who are thinking about nursing. And that's relatively unusual. Most OECD countries have seen a drop between these 2 points in time. You have seen an increase. So there's something there that's a positive that you should hopefully be able to work with. I said that I would spend a little bit of time on technology. I'm aware that it's very much, understandably, a theme that is central to this forum. And it's clear that technology is progressing rapidly, has huge potential within healthcare in all sorts of ways, from just supporting individual health professionals to load data more quickly and understand and analyze data more quickly, through to new technology which can provide robotics in surgery, through to AI even. And this is fantastic, and it's great, but if we look back at the impact of technology in the health sector, it usually lags. It's usually slower, the uptake is slower, the dissemination of new technology is slower than has been anticipated. And that's in part because systems, be they national health systems like here and in the UK, are centrally funded, and it takes time to progress new ideas, new innovations, and get them rolled out. But it's also, I think, important to consider system preparedness and workforce preparation for using any types of new technology. The technology itself is nothing until it is being used, and it is being used by health professionals and other health workers. And unless they are trained, comfortable, understand, can use, can utilize, it becomes potentially a blockage rather than an enabler. I work at the Health Foundation, which is a think tank in the UK focusing across all ranges of health policy. And a couple of my colleagues have recently published some work looking at the impact of technology up to and including AI on the healthcare workforce in the UK, and have surveyed health workers to get a sense of what needs to be in place or what is preventing them making the best use of technology. And this is just one slide from the report. I should say that all the source material that I'm presenting today is available free online, and I'm happy that my PowerPoint, which includes a reference page, is distributed to anyone who's interested. So that slide there just asks health workers, health professionals, what are the main challenges in making use of current technology? This is now current technology before we talk about new technology. And there's a range of responses, as you might think, but the key ones, reported by high proportions of those who were surveyed: a lack of support and expertise to use the technology. So there's issues there of training, capacity development, but also the health service providing the right sort of technical support to make sure that the technology can function, enable the health workforce. Inadequate funding to implement, so it's not rolled out across whole systems. It might be patchy here and there, but there's a blockage in getting the whole system up to the same level. And picking up on a previous speaker, equality of access, equity of health delivery. If the technology is only in certain parts of the system, that is preventing equity. And connectivity. Some senses perhaps a surprise, but the third most common problem was just inability to get a good wireless IT connection. Simple things like that are still getting in the way of current technology, let alone the potential for new technology. From the same report, but looking more at the broad-based recommendations about where we need to look to support the health workforce in terms of the harnessing of technology. 5 of the key points they've put up there. So giving greater priority to technology that helps not just with clinical work, but also with the basic admin, clerical, data gathering, data analysis, reporting, feeding through the system so there's good single patient record, for example. So not forgetting that technology isn't just about clinical support, it's also about system management and administration. The second point there, recognizing that many of the most immediate gains will come from the spread of existing technology. So it's don't look at the cutting edge of new technology until you've got a proper platform of current good technology. Third point, support rigorous real-world testing and evaluation of emerging technology. So don't believe what the supplier tells you when you've got something new to look at. Apply it in practice, pilot it, work with your workforce, see the extent to which it can deliver the promises that are being made about its potential. Fourth point, look at tackling the barriers staff face in effective implementation, including underlying infrastructure, the point I've already made. Do you have a good connectivity in the workplace, for example? And finally, increase staff involvement in demand signaling and technology development. So have the staff who are going to use the systems and technology involved from the beginning of the process in terms of development, implementation, testing, evaluation, and rollout. And I think that last point is very important. And there's also, when you look, some of the best new systems and solutions that are coming through in different health systems are those that have been identified and built and led by health professionals who are working in the environment, understand the real challenges, and understand how to overcome them. So that's my kind of slightly understated message around technology. I don't think technology on its own is the solution. It's technology that enables the workforce to deliver effective healthcare that we need to focus on. And the difference between the two is important and must be kept in mind when we're looking at the potentials that are coming through. So I've tried to speed up my presentation because I know we're a little behind time, so I only have a couple of slides left. And that's when I I'm moving on to just firstly a very broad recommendation for an action plan when you're looking at health workforce and the different elements of interventions that policymakers need to consider. And then my final slide will be more my own personal view on some of the issues that we need to give a priority to if we're going to talk about sustainability in the health workforce. So last but one slide. This is a busy slide. There's lots of words on it. I'm not going to try and take you through all of them. The points really are, this is the WHO Framework for Action, developed and published last year and aimed for policymakers in European countries who are looking at and have the responsibility to address health workforce challenges. And what WHO have done is categorize 5 areas of consideration and potential implementation. And the point here is that you cannot just look at one of those 5, focus only on one of those 5, and assume that you will have a sustainable solution. Health workforce challenges are complex. We can unpack them, and we can begin to look at areas of intervention, but we need to recognize that the interventions need to be coordinated and in some cases sequenced. You might need to do something in order to achieve something else. So we have the 5 headings, areas of intervention to consider. From the left, we have investment, and we've already heard a little bit about that already from the first speaker. Without investment in numbers, in skills, in technology, we can't aspire to make progress. And there is a cliche, but it's a cliche because it makes sense, that we need to look at health workforce as an investment, not as a cost. Because it's investing in the health workforce, ensuring you have the right training, additional training, are supported to be located where they can be most effective, are provided with the right sort of technology. We need that investment if we are to aspire to long-term sustainability. The second point there, building supply, and you can see some of the suggested main interventions there. That links very much then to retain and recruit. So it's getting the pipeline of new health professionals and health workers at the right scale, but then recognizing that when these individuals come into the health labor market, they make choices, and we need to support them to make a choice to continue to work in national health services where those exist as a priority. Optimizing performance. This is probably where the greatest potential lies for improved sustainability. And it's also one where technology can have a major supporting complementarity when we look at how to improve individual performance within the health workforce, but more importantly, team performance and system performance. And finally, the fifth element there is planning, looking at a national health workforce plan that, as I said earlier, allows you to look at projections, look at the impact of policy, test different possible futures. Can you reach those numbers? What do you need to do to reach those numbers? Do you need to train more? Do you need to improve retention? Where can you have the best effect in terms of trying to improve the overall progress? So the issue there is having a planning process which involves the key stakeholders and very importantly is adaptive and can change over time. Too many health systems invest a lot of time and effort in creating a wonderful plan, and then it goes onto a shelf and the world goes a different direction. So looking at a workforce planning process that is reviewed, adapted, and changed when necessary, either because of external shocks or because of internal priority changes. So just one final slide. These are just my kind of final thoughts. The problem with final slides in presentations is usually people have a shopping list. Here's 20 things to do. And there's no sense of priority or whether some are more important than others or whether there's any constraint in terms of resource availability or timing. So what I've tried to do here is picking up on the 5 key themes coming from WHO is to look then at some of the particular areas that need to be addressed, I think, if we're going to have long-term sustainability. And those include an inclusive definition of health workforce. We're not just talking about doctors or individual nurses. We need to be looking at teams. Multidisciplinary teams are going to be the best way forward in terms of achieving sustainable improvements. We need to be looking at new supply, clearly, but we also need to look at how we can improve distribution, retention of the current workforce. The more we can do that, the less we need to rely on new supply. Return and retention, looking at keeping workers for longer or encouraging them back into the workforce. Why have they left? Can something be done to bring them back? The next generation, as I mentioned, they have different priorities from life. And that means it's not more of the same necessarily. We can't predict the future generations' concerns, priorities from what happened 20 years ago. We're planning, we need to factor that in. We need to look at adaptive workforce planning, not a fixed plan. I think we need to be investing in advanced roles. That's optimizing performance, stretching the ability of individual health professionals, particularly, to work in advanced roles with advanced scopes of practice. For example, more health professionals having the ability to prescribe. And finally, just the final one there, yes, we need technology, we need to invest in it, but it needs to be harnessed and used and utilized by the health workforce if we're going to get the right sort of sustainable change. Thank you very much for your attention. I've gone through that quite quickly, but I hope it's been of value and interest. And if you're interested, drop me an email and I can make sure you get the PowerPoint slides. Obrigado. Thank you.